the turn of the agricultural revolution, we started cultivating crops. And then if you continue along the fossil record to the Industrial Revolution, which is roughly 300 years ago, the refining of grains and the introduction of sugar on a mass scale. So we see these two time periods very clearly in the fossil record that correlate with increasing carbohydrate consumption and decreasing oral health.
Hey guys, thank you so much for watching our videos. If you'd like to support us some more, you can explore our homemade natural skincare products at purelytallow.com. Thank you so much for supporting my small business.
Hey everybody, welcome to the Carnivore Revolution. I'm Serena, and my special guest today is Dr. Kevin Stock. He is a dentist in pediatric dentistry and dental sleep medicine, and I'm excited to talk with somebody that knows all about our mouths and all about our teeth, and most importantly, why it's so important what we eat. So Dr. Stock, thank you so much for being here.
Thanks for having me on. Excited to chat.
Yeah, me too. So I like to start with people's story because a lot of people just don't understand why we just eat meat and they think it's ridiculous. And so I like to start with the story about how you became so weird and decided to just eat meat too.
Yeah, and the story goes back a long time. So
Okay.
I've been weird for a very long time. Basically back to, I would say, junior high, 7th grade, 12, 13 years old. I suffered with being overweight as a kid. And it was like the number one kind of mental obsession, insecurity as a kid. And so 7th grade, I start doing weird diets. I get into working out every day. And I made all the mistakes you could possibly make throughout, high school. But I started making like little bits of progress here and there. In college, I got to do my degree in chemistry and minor in biology. I wanted to go into the sciences because I wanted to understand, like, how can I use science to build muscle, lose fat, and, make my body look the way I want it to look, more or less. So my health and fitness kind of passion started out mostly, I'll call fitness. The health side came later. So long story, but I'll say I went to dental school. How I decided on that, there's some correlation between health and dentistry, and I was talked out of medical school. So I went to dental school and I was doing some online writing because just talking about my ideas and things like that. I was doing physique. I started doing physique competitions just to practice what I preached. So I was really in the fitness realm, not so much the health realm at this time. When I graduated dental school, and we come back to this, I started a dental sleep medicine practice. So I was treating sleep apnea, but still very interested in the health and fitness of things. But besides my practice, I started developing a medical device, and found myself working many hours. I was getting older, and I didn't have the same energy that I used to have, or I wasn't feeling as good as I used to have. So that's what was the initial impetus that actually led me into, I'd done a ketogenic diet before, but I said I always cheated on the keto diet with too much protein. And so I remember I was like, all right, I'm gonna do keto strict. This is like 2016-ish. And I really limited my protein. And this was like what led into carnivore, but I lost a ton of muscle. And for me, in my past, I was like, that was unacceptable. So I was doing keto, I was doing intermittent fasting, and I was maybe feeling a little bit better, but maybe not, like not enough to justify all the losses of muscle that I was experiencing. So kind of went back to the drawing board. A lot of the previous research I had done, I remember picking up Dr. Bruce Ames' research, and it's like, I've always eaten, like, let's look at my diet. I eat a ton of chicken. I eat a ton of vegetables. So I started removing, I did basically a lectin elimination diet, removing oxalates. And before I knew it, I was mostly eating meat, but I knew I couldn't just eat chicken breast. This is circa like mid 2017. And so for the first time, I was like, I can't just live on chicken breast. So I started eating red meat for like literally the first time in any significant quantities, probably in my entire life. And I felt fantastic. And so by the end of 17 or so, I was basically just eating red meat. I remember MCT oil was the last of my keto foods to go, but I was feeling so good. I was writing about like why I was eating meat or just meat. And so that's what led into the carnivore.
Okay. Yeah, that's interesting because I think most people can completely get the idea that you were just eating like chicken breast and vegetables, because I think most of us come from that because that's what's healthy. That's what we're supposed to eat. And so you're not alone there in the chicken breast. And I hadn't had red meat like maybe once in a year when I switched to carnivore. And what I did eat was lower fat. Like when I bought red meat, I bought the really low fat. And I think people get confused. People don't realize that the carnivore diet and the keto diet, if you're doing it right, they're high fat diets, not high protein diets.
Exactly.
Yeah.
Exactly.
So
some people would consider it high protein because protein levels are so low these days. But yeah, you're right. It's really a high fat. I would say normal to moderate protein.
Yeah. So you've been carnivore for like almost 7 years then?
Yeah, just about.
Yeah. So it didn't have anything to do with with like dental stuff when you became a carnivore. Like,
No,
no.
interestingly, not so much. A lot of my research that I've done over the last 5 to 7 years, I'd say, really supports a meat-based diet. I won't say a carnivore diet, but like a
I mean,
heavy meat, hyper carnivore diet. Both my kind of particular interest is in like the evolutionary biology of the teeth and
mhm.
why they are the way they are and shaped the way they
Okay.
are, and what they can infer about what humans really actually ate in the Paleolithic when we had healthy teeth and all our
Mhm.
teeth fit in and we didn't,
Yeah.
you know, cavities are the most common disease in the world today. What was it like before? Like, what
Right.
happened? Like,
Yeah.
why are these very hard structures rotting? So,
Yeah.
yeah, a lot of my kind of research focus has been around now what your teeth can tell you about, like what you should eat.
Okay. So I think everybody knows that sugar is bad for you and sugar causes cavities in kids and stuff like that. But can you just kind of lay it out for us? How important is our diet to our dental health?
Yeah, and a few things. So, just to be, not everyone knows that. There's a big movement of Ray Peat people, and I'm a semi-student of Ray Peat, but he's got a big following online, and
Uh-huh.
I think I like a lot of his ideas, and I maybe find myself combating with them because I like a lot of their ideas. But one of the cardinal like issues is like, how can you? It basically justifies eating a lot of sugar, and I'm like,
Okay.
how can you? Because we
I haven't
know
seen it.
sugar rots your teeth, like indisputably. And the way
Right.
it works, like you're asking the question, is we have bacteria in our mouth that will ferment carbohydrates, not just sugar, but any fermentable
Okay.
carbohydrate into acids, and these acids eat hole in your teeth. Like that is the, we know that is the the mechanism of what causes dental cavities.
Yeah.
But if we actually go back further in time, the agricultural revolution, which was roughly 10,000 years ago, prior to that, we see the fossils, rarely had cavities. But
Okay.
at the 10,000 year mark, at the turn of the agricultural revolution, we started cultivating crops and really went like the initial carb-based diet, I'll say, and these are fermentable carbohydrates. We see a dramatic rise in cavities. And then if you continue along the fossil record to the Industrial Revolution, which is roughly 300 years ago, we see another leg up in the kind of deterioration of oral health. And that is more with the advent of the refining of grains and the introduction of sugar on a mass scale. So we see these two time periods very clearly in the fossil record uh, that correlate with increasing carbohydrate consumption and decreasing oral health.
Okay. Yeah, that's really interesting. So what has your research shown as far as like, because I've heard you talk a lot about how our teeth should fit in our mouth, our wisdom teeth probably shouldn't need to come out. And I mean, I have 4 kids, 3 of them have already had their wisdom teeth removed, and the fourth one probably next year. And so what is that? Like, why? Why does that
Exactly.
happen?
Exactly. A lot of people just say, oh, it's just genetics.
Right.
And it would be interesting that your genetics would work in such a way that, okay, now all your teeth don't fit in your mouth. But like we are unique in that all our teeth aren't fitting into our mouths anymore. And it's actually a recent phenomenon. Goes back to the Industrial Revolution. And your DNA, like as a species, our DNA doesn't change that quickly, such that now like 9 in 10 kids have some degree of malocclusion. Now it's crooked teeth. It includes wisdom teeth not fitting in the mouth. And the reason is our mouths are too small. So the teeth are just fitting in wherever they can, causes malocclusion. And the jaws are not fully developing. So the wisdom teeth aren't fitting in. Those are the first molars. So this stems back a few things. And it's actually, I believe, rooted in diet. And that can mean a few things. So if you're eating a wrong diet, that could likely mean you're not chewing enough. So chewing plays a very important role in stimulating the growth of the jaws, but also inadequate nutrition. We know, especially the fat soluble vitamins like A, D, and K play a very important role synergistically in the development of the jaws. So the combination of inadequate nutrition, inadequate chewing, and things like bottle feeding instead of breastfeeding, these are different nutritionally, as well as how a baby would work. Its oral facial muscles are different. And so to me, that's another root cause of food being a root cause of malocclusion. So there's a number of different like secondary causes of malocclusion, like
Uh-huh.
mouth breathing. But why are we mouth breathing? And so I think it all kind of just goes back to inappropriate diet more so than anything else.
So one of the biggest arguments I get, and I'm sure you get, is come on, we're human. We're supposed to be omnivores. Our teeth aren't for ripping animal flesh apart. So what do you help me with that? What do you say?
Sure. I mean, one thing we see throughout the millions of years of human evolution, I'm talking human as in the genus human, not Homo sapien as in the species. But for 3 million years of human evolution, we see basically our jaws shrink. But during that time, the teeth shrink with it. So like there's a congruence there. But the reason we see this is less masticatory chewing forces are necessary when we're using tools. Tools and fire play a very big role in the various adaptations that, you know, a grip and rip kind of approach would take. So tools, fire both play a very significant role in this change.
Okay. And so, but people still are like, if you can't rip an animal apart with your teeth, then we shouldn't be eating meat. And
yeah,
I mean, I have no problem ripping. I mean, I can eat a steak with my fingers and rip it apart, you know, with my teeth. But people are like really hardcore about that, about how we're supposed to be omnivores.
Well, it's interesting. So the kind of the two parts to that. One is you shouldn't the cooking and the tool. I'm trying to think of the easiest way to put this. If an alien were to look at the Earth, and we look at all the animals on Earth, humans would stick out.
They would run as fast as they could.
They would, but humans would stick out for a few big reasons. One is like the size of our brain relative to body size. But one of the things is we're like the only cooking animals. We like cook our food as well as we use tools. Other animals use tools to varying degrees as well, but we really use tools and cooking. And so, I mean, this has been unique about humans for millions of years. So that to me is not a good argument. Now, the argument for we should be omnivores, there is, and we can go to the tooth evidence as well as all kinds of like anatomical evidence as well. I believe the most substantial evidence points to Homo sapiens being hypercarnivorous. And we can talk about the evolutionary timescales, like early humans, like Homo habilis, like the earliest of the humans 3 million years ago. Homo habilis means handyman. So he was actually he was using tools. He was cutting meat. But I believe Homo habilis was far more of an omnivore, even probably plant-based, versus Homo erectus, who all the evidence points was incorporating significant amount of meat into the diet, predominantly meat even. By the time we get to Homo sapien along this timeline, it looks to be meat was the predominant nutrition in humans. But there is evidence that we did eat plants as well. So in the teeth, we can see various things like dental calculus. We can see basically plant particles stuck in the calculus. So there is evidence that we are omnivorous and we can eat plants and animals. But I believe the overwhelming evidence suggests that we are hypercarnivorous, which means humans, modern humans, are really biologically designed to eat a predominant meat-based diet, probably 70+% of our calories from animal foods and 30% or less from plant foods.
Yeah, I prefer to get 100% of mine from
which
from
many people,
at this point.
which I think a lot of people proved you can. I think a lot of people wondered, like, can you just eat meat? And I think more than anything over the last decade or so, a lot of the, with the carnivore movement is like evidence that, yeah, you can eat only meat and thrive. And I think that's a good thing overall, because it's getting closer to, I believe, what is actually a, proper kind of human ancestral diet.
Yeah, I agree. Because I mean, I'm like you. Once I switched over to just meat, I feel better than I felt when I was 30 and I'm 50, so I totally get, that. And I think if some people want to eat some vegetables, I know plants are trying to kill you. I know that. But I also think that for some people, carnivore is just a no. And so they will just veer away from it and keep doing what they're doing, which obviously isn't working for most people. And so I think if we can get people over here by saying, just eat a lot of red meat if you want to keep your carcinogens and Brussels sprouts, and if you want to keep that stuff because that's what makes you feel better in here, then keep those things. And then eventually maybe people will see the light and realize that, well, what would happen if I took those out too? And so I think that it is better to not eat the vegetables, at least it is for me. And I think everybody should start off as carnivore as kind of a starting point. So you can see what your baseline is. Like, how do you feel when you feel really good?
Yeah, and I think a lot of people have their own journeys that I think it's totally fine, because I think what you're alluding to is like, I like talking a lot about the nuance, like who should incorporate what kinds of food, how much, et cetera, et cetera, et cetera. The reality is the vast majority of people are just nowhere even in the ballpark of eating even what I would describe as like real foods, like foods that actually would exist out in nature. Yeah. So yeah, I think carnivore is a great place for, I think, even if it's like they go into it with, like you said, a short term, I recommend people do like, hey, do a 90-day challenge. And then after the challenge, I'm like, hey, here's the best, I'll say most appropriate plant-based foods to incorporate that are congruent with, you know, our biology as well as like from an
Yeah.
evolutionary perspective. And usually they back into like a good place. Like, hey,
Yeah.
that's it works for them, their lifestyle, their goals, et cetera, et cetera. So yeah, I mean, carnivore is a super powerful tool, and some people just need to be carnivore. I think Michaela Peterson's story is, you know,
Yes.
is one that's gotten a lot of popularity just to show like, I love what I love about it is like she tries to not be carnivore. She's like, I desperately want to eat these other foods, and she's like, I cannot. So
Right.
it
Yeah.
just shows like, yeah, I mean, some people need to be like very, very strict. And I think other
Right.
people can have more leniency and still have meet their health and fitness goals.
Yeah, and I agree with you. I think most people are so far off of like what we are eating, what we are doing, it, the healthy, natural foods, whole foods. So many people are, I mean, I've been with people for, a couple of days and seen them not eat one whole food. And I think that's the norm these
Yep.
days. People just don't take care of their health. They don't respect their bodies, and they don't try to take care of their bodies. So let's get back to taking care of our mouths. So a lot of people neglect their dental hygiene. I was one before I became a carnivore. When I would go in and they would say, "When's the last time you flossed?" I would be like, "The last time I was in this chair." Like,
Yeah.
I was not a flosser. Now I carry those little like floss things in my purse. I carry them in the car because I got meat in my teeth all the time. But how important is flossing for like your average person who is neglecting that mostly? And then how important is it for somebody on a meat-based diet?
That's a great question, because that's exactly people are like, oh, how often should I brush? What kind of toothpaste should I use? Should I floss? You know, should I use this mouthwash? Like all this stuff. Should I
Yeah.
get sealants? You know,
Yeah.
the questions come on, and I'm always like, well, it depends, because I'm going to just go back to the fossil record for a second. These people that had healthy mouths, all the teeth fit in, no cavities, no periodontal disease, like they had healthy mouths, and I mean, they weren't fluoridating their water. They,
Right.
you know, they weren't using modern toothbrushes and toothpaste and mouthwashes, antiseptics, and yet they didn't have cavities.
Yeah, you
And
can
I
see
believe, yeah,
though, you can see how confusing it is though when I mean, I'm sure you go into that aisle at the store and you're like, what the heck? Like
yep,
I I go in to buy toothpaste, I have no idea what I'm doing anymore.
yep.
Like there are literally 150 different kinds of toothpaste in there. I use a natural toothpaste, but some people in my house prefer like the normal toothpaste, but it's extremely confusing. I don't know which toothpaste to buy.
Yep.
It's so
Yep.
confusing.
Exactly. And kind of my baseline way of thinking about this is, if your teeth require a very robust oral hygiene practice in order to prevent cavities, your diet is off, first of all. Like,
Mm.
to me, your diet is off. There's
Yeah.
other things like you need to not be breathing through your mouth. You need to have the mouth closed, breathe through your nose. That's very important. Dry mouth will very much increase your risk for cavities. But that's my kind of my baseline. And so if you're eating a diet that's going to rot your teeth, you're going to need to have more in the way of an elaborate oral, hygiene routine. Brush twice a day, use a good toothpaste, floss every day. The basic kind of general recommendations is like, yeah, those recommendations are made because they're made against the standard American diet. Now, if you
Okay.
change and you eat a species appropriate diet, those recommendations would look a lot different. You wouldn't need to be fluoridating your water. You could just use a basic toothbrush, clean the teeth quick. You can use like a toothpaste, like just hydroxyapatite is what I recommend, because that's like what the tooth is actually made out of. So you don't need all the fluoride. You can just, clean the teeth, and like you're going to be in good shape. So yeah, the oral hygiene strategy really depends on the diet strategy. The
Okay.
worse the diet, the more oral hygiene you need. The better the diet, the less oral hygiene really matters.
That's interesting. Okay, so you mentioned mouth breathing. So, and that can lead to cavities. I have never
For
heard
sure.
anybody say that before. So let's talk about that for a little while. Let's talk about mouth breathing, what it is, why people do it, and what they can do to not mouth breathe.
Yes. So mouth breathing, it's if you just look around, and I don't even recommend it, because now you'll just see it everywhere. We're supposed to have our mouth closed, breathe through
Right.
the nose. And
Hmm.
the mouth is really, just for eating and talking, and it really should be closed the rest of the time. When
Okay.
you sleep, walking around, the only other time is during very intense exercise. Occasionally you can breathe through your mouth. Even then, I've practiced this. I maintain nasal breathing at a heart rate in the 190s. So
Really?
yes. So I think by default, that is what we want to be doing, and for all kinds of important reasons, like prevention of malocclusion and better oxygenation. But one of those things is to lessen the likelihood of cavities, because breathing through your mouth will dry your mouth. And the saliva is basically, if you're going to take a bath to clean your body, the saliva is the bath of your teeth. And when that bath goes away, those teeth really are at high risk for decay.
Okay. Yeah, I had never heard that before about the mouth breathing causing that. So what are some reasons that people mouth breathe?
So mouth breathing, it's a complex chain of events that is, I'll just tell you now, it's not well understood. Why are people breathing through their mouths now? I think there's a number of reasons, but the main reason is early on, it relates to our mouths being too small. And we talked about that. That's why we're having malocclusion, because we're going to bottle feeding, we're poor nutrition, our faces are not developing like they should. We're not chewing the food to stimulate the jaws to grow. And this small mouth, the tongue stays the same size. So we got a tongue that's too big for the mouth. The mouth, starts to hang open because we're not using these muscles. They're not as strong as they should be. And because the jaws aren't developing the way they should, we often have these vaulted palates. And so the tongue is supposed to rest on the palate, which will suction to the palate, which will keep the lips sealed. And that's the proper oral posture you want. But with the vaulted palate, the tongue doesn't rest there. These muscles start to get loose and slack, and you just breathe through your mouth because it gets too difficult to keep your mouth shut. It's like you're trying to keep a muscle tight all day long when it should be working through a suction mechanism. So I believe that's actually the root cause of mouth breathing is really, it is rooted in diet, but then there's these secondary causes that can lead to more and more mouth breathing. Things like also like environmental kind of allergens that clog up the nose, things like that.
So for people like during the day, if you're mouth breathing, you are aware and you can try to keep your mouth closed. You can try to work through that. But what about when you're sleeping? Lots of people breathe through their mouth when they're sleeping.
Yes. Very important to not be breathing through your mouth when you're sleeping as well. So a couple things. One is if you work on it during the day and you're able to really kind of learn that suction mechanism and what it really feels like, that will translate into the night eventually. For those that it doesn't translate into the night, there's a few things you can do. One is mouth tape, but even with mouth tape, it's important to trying to think about getting your tongue to the palate. Otherwise, if that tongue's sagging down, no good.
Mm-hmm.
But mouth tape will help train the nasal breathing. If there is constrictions in the nose, then a nasal dilator is a good way to help facilitate, nasal breathing. And so these are two things that you can use. And often it's on a temporary basis, 30 days or so, where you can retrain this nasal breathing through the night.
Okay, so from one of the things you said a couple of minutes ago about so our mouths aren't forming right and stuff, and is it because the processed foods don't take as much chewing? I mean, is that part of the problem here?
That is part of it.
We're not eating enough meat, we're not building up those jaw muscles. I think that's so important for parents to hear for their kids.
Yep, that is one of the reasons. I'd say breastfeeding or the lack of breastfeeding, weaning onto basically mush commercial kind of slurping down these foods. Because if you think about it, if you slurp something off a spoon, it is a very different you don't not only do you not chew, but you don't swallow the same either. Like when you swallow, that tongue should go to the roof, and it's exerting pressure against the roof would actually then set you up for proper oral posture after a proper swallow. But when you're not chewing and then you're not swallowing properly, it basically sets you up for this open mouth, unnatural swallowing that can continue on past adolescence as well. So yes, it's like you mentioned, it is the lack of breastfeeding, it is the refining and lack of chewing, and it is the lack of nutrition in these foods that all kind of come together to result in jaws and teeth that aren't forming the way that we were designed. The blueprint is designed to form.
And this is like an opinion question. This isn't like a fact question, but the American Dental Association, why don't they recommend for young children to start eating tougher meats and things like that to build up that jaw? Like if these are the problems that we're having, why are we not doing something about that?
It is disheartening. There's a movement called baby-led weaning, which is all about
Mm-hmm.
weaning babies onto real food. And
Mm-hmm.
it's not just like weaning onto meat, but it's it gets the gist of these small children need to start eating real food and wean onto real food. And the mush is just not doing us any favors. When it comes to dietary recommendations and the ADA, it's a mystery to me, to tell you the truth. And a story I tell, because it wasn't that long ago, I took a CE course, and during the CE course, they talk about the etiology of decay, what causes cavities. And we talk about karyogenic foods, and these are the high carb foods. And then the second half of this course was talking about nutritional counseling, like what a dentist should be telling their patients. And they recommend the healthy eating plate, which is basically 70% carbohydrates, like high carogenic foods. They recommend limiting or eliminating these anti-cardiogenic foods like red meat. And I'm like, this literally doesn't make any sense.
Right.
If anyone should be advocating for a meat-based low carbohydrate diet, like of all the professions,
Yeah.
it should be dentists, because we know like fermentable carbohydrates are literally causing the most common disease in the world that we see with our naked eye in the mouth every single day.
It's really sad that we can't get these medical associations. I mean, almost none of them recommend any of the things that we have talked about here today. The low carb diet, what people are eating it's killing them. It's killing them. And there
Yep.
is nobody out here except us people on the internet who people will say, why would I listen to somebody I met on the internet or somebody that you met on the internet? Like, because the medical associations are not talking about these things. And it's really just heartbreaking to watch all of these people be so sick, and to know that if they would just cut out the carbohydrates, just maybe not everything, maybe don't cut out the vegetables if that makes you nervous, just eat whole foods, vegetables, meats, some berries, like just try it. But there's nobody out here from a medical association like that people trust and respect saying to do this. It's just heartbreaking.
Yep. I think a lot of it's to abdicate, responsibility, to be like, hey, we don't want to take responsibility for this, so we're just going to defer to this healthy eating plate that's recommended by these experts employed by some government association that
Who is employed by the pharmaceutical companies and the
exactly.
food companies.
So like the incentives are totally malaligned, and I think some of the professional organizations are just like, okay, this is not in our lane, so we're just going to say do what these people say to do. So yeah.
It really just is so sad. Yeah, you got to follow the money. And when you see a study, you got to follow that money. You got to actually click on the link. Don't just read the headline. I think that's so important, because people see these headlines about eggs are bad for you or red meat causes cancer. They don't click on the links. They don't click on those little blue things that tell you where the information comes from. And chances are the information in the actual study doesn't match the headline at all.
Oh, exactly. And like something like eggs is a good example. It's like, yeah, eggs are high in cholesterol, but it doesn't matter. It doesn't even like change your serum cholesterol. So
Right.
like there's things like that where they use something to scare you, like high cholesterol on eggs, and automatically, because people are going to associate that with heart disease, when really like your dietary cholesterol really doesn't have hardly like a negligible effect on your actual blood serum cholesterol. So yeah, the headlines are kind of designed to, to scare you and have some ulterior motive and agenda.
Yeah. Which is just really sad. And the other thing is the studies themselves, something like 80% of the time, a study is going to find favor in the person who funded it. And so, that's another thing to look at when you find those studies, when people find those studies about the way we should eat and our dietary guidelines and all that, the conflicts of interest and all of those things are just so extreme. I don't think we'll see a difference in our lifetime. Do you?
I don't know. I think if everyone's getting so sick, and you do what the government, these experts tell you, and it's just not working, you think people would wake up. And I'm hopeful that there are, like, one of the double-edged sword is like the access of information. Like you open up the internet and you can get this information, but also like you can get the good and the bad information. So it becomes discernment, but at least ulterior or like different perspectives are available for people to be like, hey, I've tried this that's recommended by the healthy eating plate, and it's just not working. My teeth are decaying, and I've got tens of thousands of dollars of dental bills. Maybe I should try something else and try this, low carb, a lot of meat diet.
Yeah. It's just so scary for some people, because every doctor you go to, almost every doctor, I mean, there are some, but almost every doctor you go to is going to say to limit red meat. And, even for diabetics are getting information that they should limit their red meat, like limit their protein even. Yeah. It's just
crazy.
Because all the foods they're recommending are just going to raise the insulin, the glucose number. They're not helping people. Which is
like a diabetic is not like they have a problem dealing with carbohydrates and blood sugar, and they're like,
let's give them more carbohydrates.
Carbohydrates and sugar is fine. Let's limit the steak, which is protein and fat. Like it doesn't make any sense.
It really doesn't. And then you have to really think, like, I don't want to think there's a conspiracy. I don't want to think that. But information like that does make you wonder, like, how could they not know that the protein and the fat are the things that aren't going to raise the insulin, right? Like,
Right. Their blood sugar control is
yeah,
what's out of whack. And the one thing
yeah.
that's really setting it out of whack is the carbohydrates. And it's like, no, eat your carbohydrates, but limit the red meat. It makes no sense.
I mean, it makes me crazy. It makes me like feel like I'm the one who's crazy sometimes. So what does a typical day of eating look like for you?
So right now, or for the last 18 months, or actually more than that now, I've been doing just beef, eggs, and raw milk.
Okay.
And I mean, there's backstory to this. I'm happy to go into it, but almost 2 years ago now, I wanted to do, still into the fitness realm. So I was
Right.
going to do an 18-month carnivore bulk. So
Okay.
put on some weight, put on some muscle. So I introduced like the raw milk for the first time 2 years ago. Prior to that, I had basically never drinking much milk of like throughout my life. So I started the raw milk, and then I've not eaten any other meat. So just beef, some eggs, and the raw milk. Over those 18 months of bulking, I put on like 33 pounds. And right now I'm in like the fat loss phase,
Okay.
the end of this 2 year journey. And I'm still just doing like mostly beef, eggs, and raw milk. But like the raw milk, to lose the fat, I've decreased the raw milk
Okay.
and a little bit of the beef, and threw in some cardio. So that's what I'm doing right now.
Yeah. That's cool. I mean, I think, beef and eggs are the most nutrient dense foods. And so I think if you can be a carnivore that limits to that, which I have a hard time doing. I do have an issue with cheese. Like I love cheese.
You
I'll
love
eat cheese on cheese on cheese if I can. I don't always stick with just that, but I know for a fact that that's when I feel my best. And so
Mhm.
when I'm being really strong, I can stick with just that and feel really good. And usually lose a few pounds too. I tend to do better with higher fat. Do you pay attention to that at all? Like higher fat versus protein on a normal basis?
I've messed with it all, and when I increase fat intake, I will gain weight more easily. Which,
Interesting.
by the way, I think it's important to clarify, because you mentioned cheese, and I think about this a lot. Like you may feel like you eat cheese and you don't have any digestive issues, you feel fine with it, but
Right.
you gain some weight. I don't think that's actually necessarily a bad thing. Now, if you're eating cheese to the point where it's like became like I don't know if you could, is kind of where going with this. Like, for example, I can drink this raw milk and I definitely gain weight, and I can eat really fatty cuts of steak, which will also cause me to gain weight. But I actually don't think I can overdo this to the point of like getting obese or diabetic or like
Mm.
health consequences. I will
Right.
gain weight and be like, I don't even like to say like healthy, like
Yeah.
soft, but like more body fat, which is
Yeah.
not maybe what I want to look like. But I actually don't
Right.
think
Yeah.
it's necessarily a problem unless you have the body composition goals. So it's an
Okay.
interesting perspective. I think you can have, like, for example, I could be at probably 20% body fat, which is more than I normally am. And I'm drinking raw milk and eating cheese, and the fattiest cuts of steak, and I'm eating until I'm satiated. I'm at 20% body fat, which is more than maybe I want to look like, but I think that's probably like healthy.
Feel
Like there's
very
no
good.
problem with it. So
Right.
it
Yeah.
becomes a problem if someone's like, "Hey, I want to
Yeah.
be 10% body fat. Why can't I
Right.
get there?" And I'm drinking raw milk and eating cheese, and
Right.
but like to your point, I know some people do better with higher fat than protein, and by better, I guess I should. There's a way. How do we define better? Are we talking about
Right.
fat loss? Personally, for fat loss, if I wanted to like lose fat, like I'm doing right now, I will increase protein and lower the fat,
Yeah.
and it works literally every time for me. I've worked with other people where that is not always the case.
Right.
I would say more people than not, and not everyone, but more people than not, is if they want to move the fat loss dial, it is increase the
Yeah.
protein a bit, decrease the fat a bit.
Yeah, I think it can be used as a lever, like you can kind of mess with it. I
Yep.
was eating I was making cheese crackers where you like cut the cheese slices and put them in the oven and get them crispy. And then I was sprinkling cheese on top of those, and then I was drizzling queso on top of that. I think that's probably a little I think that's probably a little bit much. Cheese on cheese on cheese. That's what I like to do. Okay. So do you
Yes.
have any book recommendations for anybody? Anybody out there listening for carnivore or teeth health or anything?
That's an interesting question. I don't know if I have any recommendation that comes off the top of my mind, but it would just be dependent on what someone's looking to do, I think.
Okay.
So, like, if you're looking to get started with carnivore, I mean, of course, Sean Baker's got a very like easy to read book. Judy Cho's
Mm.
got a good like introductory
Yeah.
book, things like that. If you're interested in like ancestral dental health, like these are the kind of the books that I'm reading all the time.
Yeah.
There's some good there. Regarding the breathing, one book that is worth mentioning is, it was a bestseller, James Nestor. It's called Breath, and
Okay.
it reads non-academic, which I think is great, but
That's
also
great.
it's like filled with very good information. So that's a like a very to people that are just like, hey, why should I be breathing through my nose? What's that all about? That's
Okay.
a fantastic book to read. So I read that a couple years ago, expecting it to be like, oh yeah, this is going to be a boring like shut your mouth, breathe through your nose book, but it was good. He covered all the like relevant good stuff. So that would probably be my one recommendation in the breathing realm.
Okay. All right. I'll make a note of that. That's what I need to get. Well, thank you so much, Dr. Stock. This was really insightful. And I think hopefully we helped some people today.
It's a pleasure being on. Thanks for having me.
Thank you so much. And we'll see you next time on the Carnivore Revolution.